So good morning. APCCC, or APCCC, some people call it that way, is the Advanced Prostate Cancer Consensus Conference. And we started it first time actually about 10 years ago, 2015. And it's a conference where we really try to concentrate on issues where there is no strong evidence and where we need consensus of experts to guide us.
And actually 2015, when we started, oligometastatic disease was the hot topic at the time. Pete Doss did a great presentation then. And of course, sequencing of treatment options in mCRPC. And over the years, the topics have changed, but there are always unanswered questions where we don't have evidence, or maybe also conflicting evidence. So there's always a lot to discuss at APCCC.
So in APCCC 2024, and for everyone, there is open access. We've published it in European Urology, so everyone can really have a look about the questions where we found consensus or not found consensus. Interestingly, there was a lot of non-consensus. And I think this is also just like a proof that we choose the right topics, because there is no evidence and even experts are not very clear about what they should do or not do. And I think one of the really big issues is the next generation imaging.
And also biomarkers, genomic biomarkers. We had actually a lot of questions, almost half of the questions were on high-risk localized and biochemical relapsed prostate cancer. And we thought that this topic could be expanded, and that's why Stefano Fanti and Ken Herman organized this APCCC 2025 to really address all the diagnostic issues ranging from localized disease to advanced disease, with more experts from nuclear medicine, pathology, radiology. And I think so far from what we heard yesterday and today, there were great talks and a lot of discussion, more than we could ever have covered in the regular APCCC.
And you know, the interesting thing that we heard also today is kind of like the imaging is kind of always a step ahead of the clinical trials. So in that sense, you know, like we should finally like go and do clinical trials where the PSMA PET is integrated. But then, you know, there's already the new, even newer generation imaging on the horizon. So we will be always too late. So it was quite funny, like Pete Doss said, oh, he tried to submit a paper and the reviewer came back and said, oh, some people got not PSMA PET, but choline PET. So this is totally out of everything. But then Pete said, but, you know, we need time to do the clinical trials. So there will be, you know, it's the risk that we always have maybe an imaging that's then in the moment already outdated. So what is quite cool, right? So we have new options, but also we have to learn how to handle these situations.
So I think APCCC can really address and highlight such issues without actually solving it. It's an expert meeting, an expert consensus. And we've been busy taking notes for APCCC yes. 2026, because some of the topics we heard, we thought are very well suited also for a more broader clinical oriented right. Audience that we can take up and expand in April 2026.
Yeah, especially, I mean, this is really something, and it was also mentioned more than once, you know, the patients where we find PSMA positive lymph nodes that on conventional imaging would have been judged as no lesion, like normal. So what are we doing? And we have to be very careful not to overtreat patients. I think this is something we discussed a lot, also in diagnostics, also in APCCC, and we will discuss a lot in also APCCC 26. And another thing that we found out is like there is a very like differences between countries for the availability of, for example, PSMA PET or also whole body MRI. So I guess, you know, you can't say what is good in Australia is also the right thing to do in other countries where it seems some people have to wait 1-2 months to get for their patients a PSMA PET. So maybe in these countries, it's a bit different what you do as you first imaging if you have a very high PSA to start with.
And I think with technology advancing so fast, we discussed this also, there's a risk of over-treatment in some patients and also under-treatments in others. And I think this is something we want to address in 2026. In which patients can we safely de-escalate maybe the treatment options, and in which patients should we maybe be more proactive and not treat everyone the same. And I think this is really something where the field is going towards too.
And one other point I think is, that we discussed a lot now, but, then also we always concentrate, or a lot of us concentrate on the cancer, but there is also a lot of other factors that are very important, like comorbidities, especially in the early settings. And we have to start to include that much more in our thinking, in our decision making. And I think we're gonna really again also address these issues in APCCC 2026. So really a heartfelt invitation to everyone who's interested in the management of patients with prostate cancer to come to Lugano 2026. I think, one thing that I saw again, usually the talks are excellent, they are short, focused, very good, but the really important stuff comes actually afterwards in the questions and answer. The things that we are discussing are the things that are so essential in everyday clinic.
And most importantly, anyone can attend. It's called a consensus meeting, but it's not a closed door meeting. Anyone who treats patients with prostate cancer can really come and enjoy the discussions and the talks and also the interaction with the experts in the breaks. So 30th of April to the 2nd of May 2026 in Lugano with beautiful weather, hopefully, a beautiful sunshine. We look forward to seeing a lot of you here.